I want to talk to you for a minute about a new project. A drug we're investigating right now is Viagra. Viagra, Cialis, Levitra, household names. You can't watch 5 minutes of TV without seeing the couple holding hands in the tub at the end of the commercial. What's the problem with Viagra? If you ask anybody on the street, we're looking into a new case about Viagra. What do you think the problems are? They might look at you and say, I don't know, erections lasting more than 4 days. They might say divorce. They might say blood pressure problems, heart problems. But nobody even comes close to what we're investigating. What are we investigating? Well, there has been a study that's come out that links the use of Viagra to the acceleration of the development of melanoma. Melanoma also being a household word. And you think to yourself, how in the world can taking Viagra potentially exacerbate, accelerate the development of cancerous melanoma? Well, the theory behind this, according to the researchers at this point, is that the mechanism of action of Viagra essentially is it affects some enzymes that relax the smooth muscles of the body. That's actually exactly how Viagra causes an erection, is the smooth muscles of the body, significant amount of which are blood vessels. When they relax, it promotes blood flow. It actually makes the blood vessels relax and get bigger, and it promotes blood flow. And blood flow obviously is what causes an erection. The problem with Viagra potentially, and as discussed by these researchers, is that that same mechanism of action, the enzyme that actually is affected or blocked that causes the relaxation of the small muscles, also has a lot to do with the mechanism in the body that could potentially promote an existing melanoma lesion from letting go some of its cancerous cells and disseminating that throughout the body. This would be a melanoma lesion that potentially is not even diagnosed yet, subclinical, maybe even undiagnosable yet. It's not the brown patch that everybody knows that melanoma looks like, so that when you routinely go to your dermatologist, they don't even see it yet. Melanoma, unfortunately, or fortunately, if diagnosed timely, is a very curable disease these days. I myself have had 2 melanoma or pre-melanoma lesions diagnosed timely, and they're removed, and the pathology is clean, and knock on wood, for one was about 8 years ago, the other one was just this past year, clean so far. The problem with men who take Viagra that potentially don't even know they have melanoma is that it is now, at least in question in the medical literature, whether or not the taking of Viagra for those men could increase their risk of developing systemic melanoma. So what's the takeaway for this, for anybody that's watching this video? Right now there is medical literature that suggests that the potential exists for the taking of Viagra to increase a patient's risk of developing systemic melanoma for those patients that already have a melanoma type lesion, even if it's not diagnosable yet. So if you are a patient that, I would suggest, if you're a patient that regularly sees a dermatologist, has never been diagnosed with melanoma, and then is diagnosed with a metastatic-type diagnosis of melanoma, as opposed to a tiny lesion. Viagra is not going to cause the tiny lesion that you see on your shoulder or your back or in your scalp. But if your original melanoma diagnosis is for what appears to be a metastatic form of the melanoma, and you've been a user of Viagra, you should go to your doctor and ask the question as to whether or not the taking of Viagra could have caused what otherwise would have been a pinpoint lesion that could have been diagnosed and treated successfully, and turn that into a life-threatening situation of a metastatic type melanoma.